We are going to be reviewing 12 home remedies to prevent hair loss and regrow your hair.
Onion juice, apple cider vinegar, biotin.
Hi, this is Rob at Perfect Hair Health, and in today's video, we are going to be reviewing Dr. Eric Berg's advice on hair loss. Specifically, we're going to be reacting to a video titled 12 Home Remedies to Prevent Hair Loss and Regrow Your Hair. And I've gotten a lot of questions about people asking for my perspective on his advice for hair regrowth as a medical editor, as somebody who's been involved in the peer review process, both as a first author of publications and as a reviewer of other manuscripts, as somebody who is on the editorial board of a dermatology journal. What are my thoughts on Dr. Eric Berg's advice to people fighting hair loss? What does he get right? What does he get wrong? Does he exaggerate any claims? What is he not telling us? Because I can tell you, after watching this video, there are certain points of contention that I have with what Dr. Eric Berg is recommending. And I think the most important thing to do is color in some context that might have been left out. I don't have anything against Dr. Eric Berg. I know that he produces a lot of content. I know that he has helped a lot of people. It's no surprise that our healthcare system is broken, that people are suffering, and that figureheads like Dr. Eric Berg, well, they empower us to become healthier and from a natural perspective. I mean, what he does is really admirable. But it's also hard to be an expert in everything, especially across so many topics on his channel, which is why I think that critical evaluation and appraisal are so important here. The goal of this video is not to make him look bad. It's just to show you what my perspectives are based off the content that he's producing. And as we peel back the curtains to some of these recommendations, we'll actually see that Dr. Eric Berg's advice on hair loss is truthful in many circumstances. It's just that these truths, they tend to apply to only a small number of people fighting hair loss. Or in other circumstances, those truths, they might be derived from test tube experiments, but not human studies. And we'll reveal examples of why this distinction is so critical. And without that context, you might end up fighting hair loss around the wrong paths, or you might end up thinking you're fighting hair loss, but 6 months down the line, you're still losing hair, you're still wondering why. Well, it might be because of what we're about to learn. So let's check this out.
We're going to talk about the 12 simple and very powerful home remedies that will not only help you prevent hair loss, but also help you regrow the hair back. You know, losing your hair is a devastating experience, and you want to try natural things first before you try medication, simply because there are side effects.
It is absolutely true that drugs can come with a risk of adverse events. Randomized, double-blinded, placebo-controlled studies on hair loss drugs specifically, some drugs can associate with certain side effects. For finasteride, that is usually sexual dysfunction that affects, depending on the study that you cite and depending on your definition of what a side effect is, about 1% to 15% of individuals trying that medication. What is Dr. Eric Berg not saying here that I disagree with then? Well, it's the notion that you want to try natural things first because drugs come with side effects, because natural things also come with side effects. Arsenic is natural. Arsenic can kill us. Water is natural. Too little water can kill us. Too much water can kill us. So there's context here that's lacking, but most importantly, there's context even in relationship to health outcomes. I'll give you an example. That drug finasteride that we just talked about earlier, over 18 plus year clinical trials on 30,000 plus individuals. That drug is associated with a directional decrease of prostate cancer by about 25%. Vitamin E supplementation and selenium supplementation is associated with an increased risk of prostate cancer, especially in men who already have adequate selenium or vitamin E levels. Vitamin E, selenium, natural, finasteride, a drug. One is associated with a decreased risk in prostate cancer. Another is associated with an increased risk of prostate cancer. Again, context matters here. We have to be careful about making blanket statements like this. So that's the first thing. The second thing is that I don't think that somebody should default to natural interventions or conventional interventions just because of this presumption, which I don't believe to always be true. Rather, I think that somebody's proclivity toward a natural versus a pharmaceutical approach to fighting hair loss should be determined predominantly by the rate at which they're losing hair. So clinical trials have demonstrated that men affected by androgenic alopecia lose hair on average by about 5% hair volume per year. But that is an average that is made up of a bell curve of data. On the one side, you have some people losing hair at a rate of 1% loss per year. At another side, you have people losing hair at a rate of 30% volume decreases per year. So 5% is the average. If you're losing hair at a rate of less than 5% per year, that typically means that over 3 to 5 month periods, you don't even really notice cosmetic volume decreases to your hair overall. And in those cases, natural interventions might be favored for people who want to try to avoid drugs, because the opportunity cost of trying those natural interventions that come with far less clinical support, lower qualities of data, higher variabilities in success rates, lower magnitudes of growth outcomes relative to the drug approaches. Those things might work for you, and if they don't work for you, then guess what? It's not that bad, because at most you risked 1%, 3%, 4% loss in hair volume, which for most people is a risk that they're okay taking. Now say you're on the other side of the bell curve. Say you're losing hair at 30%, and you hear a statement like that from Dr. Berg. Now you default to natural interventions that have lower clinical levels of support, lower qualities of data. Guess what ends up happening? Say they don't work for you. Say that over the next year, you continue to lose hair at a rate of 30% loss in volume yearly. That is cosmetically significant. That is a problem. And you could have hopped on the pharmaceutical interventions at that point and had a higher likelihood and magnitude of success, but you didn't, because of advice like that. And that is where things get a little bit murkier. So I think that the recommendations to pursue natural first over drugs, because of drugs having side effects, I think that at the face value, that statement is wrong, that it requires more context. I think that somebody's choice to pursue natural interventions first over the drug interventions really should be determined by somebody's rate of hair loss. If you've got a fast rate of hair loss, put yourself in a position to succeed as soon as possible. If you've got slower onset hair loss and you want to really try the natural interventional approach, awesome. Try those, set your end marks for when you're going to evaluate your progress, and then move on to stronger, more clinically supported interventions if at those measurement points, you're not seeing the outcomes that you want. So that's the context that I wanted to provide for this statement alone.
Now, the first two things I want to talk about, very important, very significant, but very few people are aware of this. So if you think about what the hair is exposed to on a regular basis, well, you take a shower and you're exposing your hair to the water. Did you know that the fluoride in your water creates significant hair loss as well as acne in your skin? Yes, this is true. The fluoride.
All right, let's evaluate this claim. We'll use data that Dr. Eric Berg references to show that fluoride can cause hair loss. Then we'll dig a little bit deeper to see if this research applies to humans as well. There is in vitro data, meaning studies done in a petri dish, that when you expose hair follicles to fluoride in a dose-dependent manner, those hair follicle cell sites can undergo damage, with higher dosages corresponding to more damage to the hair follicles. And in this regard, you can demonstrate that there is a relationship between fluoride exposure and certain problems with hair follicles, human hair follicles. That is a petri dish related study. So what sort of clinical data do we have on fluoride exposure from showers or from drinking tap water that can actually give us better insights into this? So, well, there's one study that showed that in Mexico City, in areas that were highly fluorinated for tap water versus less fluorinated for tap water, the kids exposed to fluorinated tap water in this one study have a slower onset of puberty. So we actually see them grow in pubic hair later in life than the individuals who did not have the same exposure volumes of fluoride. That's interesting, but pubic hair growth isn't driven exactly by the hormones that drive male pattern hair loss. In fact, pubic hair growth in the armpits and in the groin is actually more closely associated with estrogens. Okay, so what other data do we have? Well, there is a study from the 1940s, and it showed that 29% of people with mottled teeth, that's basically what happens when you drink too much fluoride. Well, these people also complained of hair loss. So, okay, that looks concerning, but the number also isn't that far off from the average percent of people complaining of hair loss in the same age cohort. I mean, that same study also found that 26% of people with the same age, the same gender, without teeth modeling, were also worried about hair loss. So we're talking about a 3 percentage point difference here. Unfortunately, beyond the data that we just presented, I wasn't able to find any information linking fluoride exposure to human hair loss or an accelerated outcome of hair loss. This is going to be an important through line for the rest of this video, because to demonstrate cause and effect, we generally need 3 different types of evidence. The first is observational. So in this case, that'd be higher rates of hair loss in people who are exposed to more fluoride. Then we would need mechanistic evidence, as in exposing hair follicles to fluoride can actually damage them. And that's kind of where petri dish and animal studies come in. And then finally, we need interventional evidence, as in reducing fluoride levels in humans can actually help to reverse hair loss. So if we are extra generous, we can give Dr. Berg a pass on observational, even though I think a 3 percentage point difference is basically biologically meaningless here. And we can even give him a pass on mechanistic data, even though in my opinion, the levels of fluoride inside that petri dish study, they were insanely higher than what we'd get from our typical shower exposure. And yet we still don't have data showing that reducing fluoride levels in humans reverses hair loss. And if you want an example of why all 3 levels of support here are so important, especially in hair loss research, just rewind the clock to 2012 when every single person fighting hair loss on hair loss forums got super excited about a substance called prostaglandin D2. They found this substance to be elevated in balding scalps, hindered hair lengthening in mice. But when people reduced prostaglandin D2 in clinical trials, well, they failed to produce better hair growth outcomes than a sugar pill. Again, we need all 3 levels of support here, and if we don't have it, we have to take recommendations like this with a grain of salt. That's not to say that there might not be a relationship here. There very well could, but we don't have any data yet supporting these assertions, and so we're only relying on the mechanistic data. And again, that can be problematic. We'll find out why later.
So testosterone turns into DHT, a very powerful form of testosterone, through this little enzyme. And so these drugs inhibit that enzyme. The enzyme is called 5-alpha reductase. And people that have too much DHT get this condition called androgenic alopecia, which is pattern hair loss, both in males and females.
I agree with everything that Dr. Eric Berg just said. Androgenic alopecia, it's one of the most common hair loss disorders in adults. It's chronic and progressive without treatment in most cases, and it's defined through hair follicle miniaturization. And the way that miniaturization occurs is through the scalp's exposure to dihydrotestosterone, or DHT. That is a male hormone metabolite of testosterone. And the best studied hair loss drugs that we have available on the market, like finasteride, or even its more powerful non-FDA approved options, dutasteride, inhibit the enzyme 5-alpha reductase. That is the enzyme that converts free testosterone into dihydrotestosterone. By blocking the activity of that enzymatic reaction, we can end up lowering DHT levels, lowering scalp DHT levels specifically, and of course, seeing hair count improvements. The best data that we have suggests that over 2-year periods, 80 to 90% of men using finasteride will see an improvement to their hair loss overall. And on average, you get about a 10% increase in hair counts plus some hair thickening, which overall leads to about a 20 to 30% increased weight of hair. It's well studied. We know that it works. Let's see where he goes.
All right, so now the question is, are there natural things that can inhibit this enzyme? Because, of course, the drugs have side effects. And the answer is yes.
Of course, if we can default to something that's natural and works and comes with a little to no risk of side effects, what an awesome option. There's a stigma around drugs. I'm not saying that people have to use drugs. I want people to just get good outcomes and find a path to regrowth that makes sense based on their needs and their preferences. But I do have issues with blanket statements that idealize that everything natural is safe and everything that's a pharmaceutical is problematic. We need to be careful about how we talk about this research.
So there's a couple things you can do. Onion juice, which I put a video out on this one topic, is a potent natural inhibitor of that enzyme. So you dilute it in water, okay, like a 50-50 ratio, rub it into your scalp.
I checked his description in the video. I wasn't able to find any resources that he linked to that made this claim. I also checked out his video on onion juice, but this video isn't about androgenic alopecia, which affects almost all of adults if they live long enough. It's on alopecia areata. That's an autoimmune type of hair loss which affects just about 2% of the population worldwide. So I went to Google to find out where this claim might be coming from. One of the first pages is a Healthline article about the 6 foods that may block DHT and fight hair loss. Big surprise here, Healthline ranks for everything. Number 3 on the list, onions and other foods rich in quercetin. White onions contain few calories but boast a high content of antioxidants like quercetin. For example, when combined with a commonly prescribed medication to treat hair loss, quercetin was shown to decrease DHT production in rats. I disagree. When you click into the study that healthline.com references to make the claim, the study actually shows the exact opposite. These rats were treated with finasteride, a hair loss drug, their DHT levels lowered, and then there was another group of rats who were treated with finasteride but also supplemented with quercetin. That's that component from onions. What did the study show? That prostate size for these rats taking finasteride and quercetin still shrunk down to about how small the prostate would get with taking finasteride alone, but in the quercetin group, the DHT levels in their blood remained elevated. So quercetin actually protected against the DHT lowering effects of finasteride in the serum. That is the exact opposite of what the Healthline.com article is claiming. But of course, I would be remiss if I didn't mention one of these old YouTube channels of this guy, Stefan, who has male pattern hair loss and over a multiple year period was really advocating for the use of onion juice applied to the scalp, and his photos and his videos show that he actually saw improvements to androgenic alopecia from his proclaimed use of onion juice. So I'm not claiming that onion juice doesn't necessarily work. I'm just saying that when you look at the totality of evidence, the claim that quercetin inhibits DHT, it's probably the other way around, which means that if you are supplementing with quercetin and taking finasteride, you could actually be hurting your hair gains rather than helping them. So think about that.
Now, the next potent inhibitor of this enzyme is rosemary oil. There's one study that I found that showed that this oil is comparable to Rogaine as far as the effectiveness for preventing hair loss.
Dr. Eric Berg is correct. There is one study comparing rosemary oil at an undetermined dilution against minoxidil or Rogaine. And that study showed over a 6-month period that rosemary oil was just as effective at minoxidil at improving hair parameters. What marketers of rosemary oil fail to mention is that the hair count improvements seen in that study from rosemary oil were around 5%. That's basically cosmetically insignificant. And not only that, but the study didn't compare against 5% minoxidil, which is the amount that men fighting androgenic alopecia are told to use. It compared against 2% minoxidil. There's a dose-dependent effect of minoxidil. So 2% is less effective than 5%, especially in men. We can't be comparing rosemary oil to 2% minoxidil and say that it is as effective as Rogaine without having that additional context. That doesn't mean that rosemary oil is useless altogether. I certainly have seen people use it and get good outcomes. Usually it needs to be an adjuvant ingredient alongside a host of other things that you would be trying. Again, the context matters. So let's continue.
Now, another inhibitor of this enzyme is just zinc, okay? Maybe you're deficient in zinc, like a lot of people are. So the best food for zinc is oysters.
Okay, zinc for hair loss. This comes up all the time inside of our membership forums. It comes up all the time in my emails with people. I see studies about it. Let's build the best argument for zinc, and then let's build the argument against it. You get to decide where you fall in line. So first, you do a literature search for zinc and hair loss in PubMed. You'll find this study on oral zinc therapy for zinc deficient related telogen effluvium. That's a type of hair loss that occurs in humans. We scroll down and we see that individuals who had a zinc deficiency and then supplemented with zinc saw improvements to their hair. Patient 1 looks like they saw a full recovery. Patient 2 looks like they recovered from early stage alopecia areata. Patient 3, patient 4, patient 5. These patients are seeing really nice outcomes from zinc supplementation. Guess what? There's even more evidence. There's a case report that demonstrated that a female with hypothyroidism who was using thyroid medication, losing her hair rapidly, she didn't see improvements to her hair loss until she started to also supplement with zinc. Check out these photos. I mean, she's got most of her hair back within just a 4 or 5 month period after losing so much to hypothyroidism. So really good outcome. But the plot thickens even more because there is an in vitro study demonstrating that when you expose human hair follicle cells to that petri dish filled with zinc, azelaic acid, vitamin B6, there's a massive suppressive effect of 5-alpha reductase activity. And that massive suppressive effect might potentiate DHT reductions. So you look at all this data and you think, of course we should supplement with zinc. Of course this is a great idea. Until you peel back the curtains and you realize that that first study that I just showed you was on zinc deficient individuals. These generally occur in people who are alcoholics, people who have gut dysbiosis, people who have incredibly damaged small intestines that have a hard time assimilating nutrients. And zinc is rarely just the only thing that they're dealing with. And that type of hair loss, nutrient deficiency related hair loss, is different from androgenic alopecia, which is driven by hormones, genetics, and some environmental factors as well. The prevalence, according to this study in the US, this is according to 2011 data, nets us at about 3 to 10%, with the risk increasing the older the population you are. So we actually see the highest levels of risk in places like South America, Africa, pockets of Asia. Aside from that, we don't necessarily see zinc deficiencies as one of these major drivers of telogen effluvium. So we have to keep this context in mind. We generally don't see these things move the needle all the time for male pattern hair loss with androgenic alopecia. And this is because androgenic alopecia is driven by male hormones, genetics, and it's accelerated by our scalp environment, whereas telogen effluvium is a different type of hair loss. It's driven by a different set of causes. With zinc deficiency driven telogen effluvium, yes, that's a mouthful, it's accounting for just a tiny, tiny percentage of hair loss cases in the developed world. I mean, just look at this data. Meaning that for most people watching this video, they're not gonna benefit from the recommendation that Dr. Berg is making here. We'll dive into this a little bit more in just a moment.
Now we have 5. The old-fashioned home remedy, apple cider vinegar. You don't want to put concentrated apple cider vinegar on your scalp. Okay, I'm just letting you know right now, it's going to burn your scalp. You want to dilute it, like 1/3 cup of apple cider vinegar to 1 liter of water.
There is no clinical data to suggest that apple cider vinegar or its main constituent, acetic acid, improves hair growth outcomes in men or women with androgenic alopecia. In fact, there's data to suggest the opposite might be true. So there are these bacteria known as P. acnes, and they can invade the sebaceous ducts, which sit right next to hair follicles. And they can feed off of our sebum, which lubricate the shafts of our hair. And what ends up happening is that as a byproduct of these bacteria eating sebum, they produce toxins known as porphyrins. And those porphyrins react with UV radiation from sunlight to create inflammation. And that inflammation can thereby send more sebum to the site as a means to resolve the inflammation, and these bacteria actually ensure their own survival through creating a micro-inflammatory environment next to the hair follicle. When that sebaceous duct swells, gets inflamed, you get higher rates of hair shedding. And hair shedding is the step process for hair follicle miniaturization. So, in a way, these bacteria can accelerate androgenic alopecia. And so it's no wonder why between 30 to 50% of subjects in studies with androgenic alopecia demonstrate an overgrowth of P. acnes in their scalps. Why do I mention all of this? Because acetic acid, the main constituent of apple cider vinegar, when you expose P. acnes to acetic acid, they proliferate more. They grow even better. And while acetic acid can help to lower some microbial colonies in the scalp, in others it leads to a proliferative effect, and one of those proliferative effects happens to occur in a bacteria that might be causally associated with an accelerated balding process. So this is why so many people that I've worked with will talk about how they used apple cider vinegar, their scalp started to itch more and their hair started to shed a little bit more. Again, this is not true for everybody. I want to make it clear that context matters. But just as easily as you can make an argument with blanket statements over apple cider vinegar and its positive effects on hair shine and hair feeling and all that stuff, you can make the same mechanistic argument that it could be bad for you and find the same anecdotes that it's problematic. So think about these things when you're hearing these recommendations and remind yourself that there's no clinical data to show that apple cider vinegar or acetic acid by itself improves hair growth outcomes in men or women with androgenic alopecia. We gotta be thinking about this.
What if you go on the ketogenic diet and you start losing hair? What does that usually indicate? That usually means that you're not consuming enough protein. That's the number one cause. So increase your protein.
Dr. Eric Berg is correct that a calorie deficit of any type can induce hair shedding. We see this in people who are trying ketogenic diets, vegan diets, and generally crash diets. And the effect is that a reduction to your calorie intake overall sends your body into a panic. The hair follicles are one of the first things to become sensitized to that panic. Hair is not necessarily an important biological process aside from sexual signaling, so the hair is often the first to go through a shed.
If you have too much estrogen, that can affect your hair. This is why women, when they go through their menstrual cycle, tend to lose hair.
I disagree with elements of this statement. Estrogen in women is actually possibly believed to be protective against the balding process. We know this because women who take birth control contraceptives generally improve their hair cycling overall. In fact, it's an off-label treatment for female pattern hair loss. We've also seen drugs that target estrogen receptors like alpha-estradiol, where you're improving estrogen levels in the scalp skin itself. You see at least a stabilization of hair loss. So we've got interventional data to suggest that estrogen in both women and potentially men as well actually improve hair parameters overall. The third piece of this is that we see in menopausal women, where estrogen levels decline and testosterone levels rise, we see a loss of hair. We see oftentimes the onset of female pattern hair loss during that period. So there's a lot of data that runs counter to this claim about estrogen overall.
Let's talk about number 8, selenium. Next home remedy would be something to support a hypothyroid condition. If you have a slow thyroid, a lot of times you'll lose hair. And one of the key trace minerals for the thyroid to support it and help convert T4 to T3 is selenium.
Dr. Eric Berg is correct. If you are moderately to severely hypothyroid, oftentimes a symptom of that is telogen effluvium. That's hair shedding. It's temporary as a consequence to the hypothyroidism. The context that is left out here is that selenium deficiency-driven hypothyroidism is uniquely rare, as is iodine deficiency-driven hypothyroidism, at least in the developed pockets of the world. Estimates that we have suggest that 10% of adults overall will experience hypothyroidism. Maybe it's higher for subclinical cases, But selenium deficiencies that are severe enough to cause hair loss by themselves, they generally only present in places where soil is completely devoid of selenium. And we are talking Siberia, Tibet, we're talking pockets of China. These cases of selenium deficiency driven hair loss are very, very rare. And in fact, too much selenium can also be problematic for our hair. So the idea that we could improve hypothyroid states with selenium supplementation, I believe that in certain contexts. But again, that applies to about 10% of the population, and a smaller percentage of that will be the ones that are actually affected by hair loss, and an even smaller percentage of that will be the ones that are affected by selenium deficiency driven hypothyroid-based telogen effluvium. That is a mouthful. It's a mouthful because it's a very unique case. So to have this as number 8 on a list of 12 home remedies to regrow your hair and prevent hair loss, I think that this is a little bit nitpicking. We have to contextualize where these recommendations come from. Of course, let's support the thyroid. Of course, let's be replete in selenium, but not too replete because that can raise our risks of prostate cancer. We got to think about this context when we're evaluating claims like this.
Increase your vitamin D. You want to get more sleep, and you want to start exercising to reduce stress. Stress is a huge problem with your hair. In fact, a lot of people, if you ask them, when did you lose your hair? After an emotional, stressful event.
Let's back up really quickly so that we can contextualize this and make it impactful for anybody watching this video. There's basically 2 main types of hair loss. There's androgenic alopecia, which is chronic and progressive. It's driven by genetics, it's driven by androgens like male hormones, dihydrotestosterone. It's accelerated by environmental factors as well. And that whole process of androgenic alopecia progresses through miniaturization. Miniaturization only happens through hair shedding. So that your hair sheds out, the old follicle collapses, a new one comes in to take its place. But when that new hair follicle is forming, damage is induced at the base of the hair follicle by that hormone DHT. You end up undergoing apoptosis in dermal papillae cell site and epithelial cells, and that takes your hair follicle size from pretty big in the last cycle to smaller. And then that process in the next hair cycle repeats and repeats and repeats. That's how androgenic alopecia progresses. There's another type of hair loss known as hair shedding disorders. That's telogen effluvium. And these are caused by acute stressors. They're caused by stress. They're caused by trauma. They're caused by surgeries. They're caused by micronutrient deficiencies, vitamin D, vitamin B12, biotin, iron for women especially. And these things induce dysregulations to our hair cycle, whereby too many hairs shed out prematurely, and then there's a gap between when those hairs shed out and when our hair cycle kickstarts to regrow again. Now, in these cases, it's a temporary type of hair loss. You address the underlying cause, then the hair cycle normalizes, hairs start to grow again, and then a year or so later, it's like you never lost hair to begin with. But there's an interaction point here. The interaction point is that if you have the genetic and androgenic predisposition for male pattern hair loss, and you go through one of these bouts of telogen effluvium from stress at work, or from a vitamin deficiency, or from a nutrient imbalance, then of course you're gonna lose hair it's gonna be temporary. But then when you resolve those temporary causes, you replete your nutrients, those levels return to normal, the hair cycle starts again. But if you also have the background risk for androgenic alopecia, when those hairs come back, they're gonna come back miniaturized. You've had telogen effluvium unmask androgenic alopecia. And when that happens, now you need to start targeting the scalp environment, the androgens, the equation for what you should target changes. So we cannot always presume that what preceded our hair loss is what is still causing it. If you're one of these cases whereby you have a stressful job, you lose tons of hair over a 3-year period, you quit your job and you move to a surf town and you just chill out for the next few years. You might improve your telogen effluvium, but that hair is gonna come back miniaturized, and you need to recognize that, change your targets a little bit. So that's the context that I think needs to be added to this part of the discussion.
Lastly, 12. If you look at a lot of remedies for hair loss supplements, they always add biotin. Now, what's this biotin? Biotin helps proteins in your body, especially hair. Biotin will help.
Okay, there is one study that everybody cites to demonstrate that a biotin deficiency can cause hair loss and that biotin repletion, supplementing with biotin, can regrow our hair. It's a literature review that summarizes a series of case reports on, I think, 16 or 18 individuals. Guess what? All of them are under the age of 6, and almost all of them had a genetic mutation known as a biotinidase deficiency. They literally could not assimilate the biotin that they got from foods, and so they became severely depleted, and they had to supplement with biotin to get themselves out of that deficiency. In those cases, biotin deficiencies lead to hair loss, and in those cases, when you supplement with biotin, you see massive hair improvements because you address telogen effluvium-based shedding from a biotinidase deficiency. However, the number of people who have a biotinidase enzymatic mutation to this degree to cause hair loss is about 1 in 110,000 individuals. And that's why when you look at women suffering from hair loss with moderate degrees of biotin deficiencies and you supplement them with biotin, when they come back to the clinic later, they see improvements to dermatitis or seborrheic dermatitis and their skin flaking gets better. They don't see improvements to hair counts overall. That's generally not what you see. So again, the severity of the deficiency matters. That's the context that's missing here. All right, so that's Dr. Eric Berg's video. That's my reaction to it. Those are my responses to some of the claims that he makes. Do I agree with Dr. Eric Berg's messaging and intents? Of course I do. I think that he's an individual that wants to help people, and he's got amazing testimonials on his website for people who have lost weight or improved their autoimmunity. He's obviously a figurehead that gets a lot of attention, and he's somebody that I think has his heart in the right place. But I think his advice falls short in this video. I hope that this video helps to color in some of the blind spots that I think were in this presentation. And again, when you're fighting hair loss, time is of the essence. So think about these things. I hope that the context provided for Dr. Eric Berg's video helps enhance your understanding of his recommendations. And keep in mind that this is just my perspectives, and that since I didn't really have the resources by which Dr. Eric Berg was using to come up with these claims, a lot of times I'm doing my own homework on these. So I can have blind spots too. Those are my thoughts. I hope they help. I look forward to seeing you next time.